system. Embryologically, the spleen is first, embryology. Spleen arises from mesenchymal cell located between the dorsal mesentery between the aorta and the stomach. According to gross anatomy of spleen, is large lymphoid organ in the body. It's switch-shaped, soft, highly vascular organ. Have two surface, diaphragmatic surface posteriorly and the visceral surface anterior-inferiorly to the right. Also two lobe, upper lobe which is tapered and lower lobe rounded. Have two borders, upper border have splenic notch and lower border. According to the splenic surface, diaphragmatic surface which located posteriorly or attached to the left costodiaphragmatic recess through the diaphragm. Also adjacent to the 9th, 10th, 11th rib. According to the visceral surface, this is the visceral surface attached superiorly to the fundus of the stomach, inferiorly to the left colic flexure, posteriorly to the left kidney and left adrenal gland. Peritoneal covering of the spleen. Spleen covered by peritoneum completely, except at the hilum, where it forms many ligaments and the splenic vein and artery attached. According to the splenic ligaments, the major ligament, gastrosplenic ligament, splenorenal ligament, also called lienorenal ligament, splenocolic ligament, and phrenico-splenic ligament. According to the gastrosplenic ligament, this gastrosplenic ligament attach the spleen to the greater curvature of the stomach, have two vessels, short gastric artery and left gastroepiploic artery. Splenorenal ligament, also called lienorenal, contains splenic artery, splenic vein, and tail of pancreas. Splenocolic ligament attach the spleen to the splenocolic ligament, number 6, attach the lower pole of the spleen to the left colic flexure, have no content. Splenophrenic ligament, number 2, splenophrenic ligament attach the upper pole of the spleen to the diaphragm posteriorly. Microscopic anatomy of the spleen. Spleen have two components microscopically, which important in the splenic imaging. White bulb centrally, this white bulb, have T and B lymphocyte, and red bulb peripherally have plexus of venous plexus. Location of the spleen. Spleen located at left upper quadrant, its lower lobe, left upper quadrant, its lower pole posterior to mid-axillary line, it's adjacent to 9, 10, 11 rib. According to the diameter of the spleen, length 12 cm, width 7 cm, and thickness 3 to 4 cm. Also can diameter according to 1, 3, 5, 7, 9, 11 rule. Measure 3, 5 inch and the weight 7 inch and adjacent to 9, 11 rib. According to blood supply of the spleen, arterial supply by splenic artery. Splenic artery هو الميجر branch, terminal branch of the celiac trunk. Celiac trunk arises from aorta. The celiac trunk, this aorta, celiac trunk have 3 branches. Last terminal branch was splenic artery. It's arises from the celiac trunk to the splenic hilum, have tortuous course in the superior border of the spleen. At the splenic hilum in the splenorenal ligament, it divided into superior branch and inferior branch. Each branch have 4 to 6 small branches. In the venous drainage splenic vein. The splenic vein also has small venules in the spleen form the splenic vein that run from the splenic hilum alongside the splenic artery at the neck of pancreas. It unit to the superior mesenteric vein to form the portal vein. This picture shows Siegel sign on ultrasound. Siegel sign describes the celiac artery and its division to the splenic artery and hepatic artery. Also, the digital subtraction angiogram, it's a technique used in interventional radiology, show the celiac trunk and splenic artery and common hepatic artery. Lymphatic drainage of the spleen. Lymph drainage, splenic hilar lymph node to the retropancreatic lymph node, then to the celiac lymph node. Innervation from celiac plexus. I have a question to my colleagues. Mention the content of splenorenal ligaments. العفو دكتور تختار حضرتك.
ماكو مشكلة، يلا أستاذ محمد اختار.
معين أستاذ رعد. إيناس موجودة؟
نعم أستاذ موجودة.
تقدرين تجاوبين السؤال إيناس؟
إن شاء الله. Content of splenorenal ligament, blood vessel, splenic vessel and tail of pancreas, splenic artery and splenic vein.
شكرا جزيلا. Splenic variant. We have 5 splenic variants. Most common splenios: polysplenia syndrome, anatomical asplenia, functional asplenia, and wandering spleen. According to anatomical asplenia, meaning no spleen. According to splenios focus normal splenic tissue that separate from main splenic body due to embryological failure. Other intrauterine life in embryology in a small splenios that unit form the spleen. Splenios هنا not unit to the body of the spleen. Up to 10 people have 10% of people have splenios with the normal spleen. Also can be identified by ultrasound by splenic artery and from splenic vein. Most commonly occur at the splenic hilum and tail of pancreas and can be seen in the intestine and the greater and small intestine and the greater omentum. According to polysplenia, هي multiple rudimentary body. Most common occur on the left. Most common occur on the left and may occur bilaterally. Number 2 to 16 number and associated with many congenital heart disease, inferior vena cava abnormality, gallbladder agenesis, and other abnormalities. This picture CT scan show heterotoxic syndrome, liver in the midline, no spleen, and only small rudimentary body. No inferior vena cava, replaced by a zygous vein and hemizygous vein. Functional asplenia. Functional asplenia, the spleen normally present but don't work well. And diagnosis by scintigraphy. Scintigraphy هي اللي diagnose functional tissue only. على حد no functional asplenia, no work well tissue. Wandering spleen هو migration of the spleen from its normal anatomical position to the lower abdomen or the pelvis due to lag or deficient or long ligaments and may tort on its pedicle. Radiological feature of the spleen. According to Blank, the spleen is not well seen on X-ray, but its lower pole can be outlined by fat. Relationship of spleen to the rib اللي هن 9, 10, 11 rib, it's so important in the traumatic case, plain film, because any fracture to the this rib may cause rupture spleen. Radiological feature of the spleen. Most proper size for splenic ultrasound. It's supine or left lateral position. The spleen is the same echogenicity or the liver, or slightly highly echogenic than the liver, and sometimes the liver become high echogenic due to its many vessels. The long axis of the spleen on ultrasound as Ryan less than 12 cm, as other textbook less than 14 cm. a CT scan of the spleen or computed tomography. The spleen normally homogeneous enhancement on the CT, but in the arterial phase, in early arterial phase, it's inhomogeneous. High CT scan axial, this is the spleen homogeneous enhanced. هنا هذا tail of pancreas. هاي portal vein, splenic vein. هنا inferior vena cava. Coronal and axial section, coronal and sagittal section. Spleen. High relation of the spleen above هنا diaphragm, هنا posterior kidney, and inferior left colic flexure. Also in sagittal view, spleen, colon. According to zebra spleen describe the normal pattern of splenic enhancement in early arterial phase in ultrasound, MRI, or CT due to in a different flow of the blood and contrast to the red and white bulb, because the red bulb early enhanced and the white bulb late enhanced. This white band describe the red bulb which early enhanced and the dark band between the white bulb which late enhanced. Homogeneous in venous phase and heterogeneous spleen in early arterial phase. MRI. According to magnetic resonance image, it's really well seen on the MRI spleen. On T2 MRI, hypotense spleen but higher than the liver. Hypotense but higher than the liver. On the T1, hyperintense, like muscle. According to reticuloendothelial system describe the phagocytic cell of immune system and the cover cell of the liver and spleen. These cells take up oxide particles which cause very dark organ on the MRI. High iron overload. This A describe the hemochromatosis. بالhemochromatosis, iron deposition in the hepatocyte. So just the liver is very dark, but spleen is normal intense. هنا B after treatment of the hemochromatosis, C secondary hemochromatosis due to primary hemosiderosis. In hemosiderosis, iron deposition in the cover cell and reticuloendothelial system. So the liver and the spleen show darkness or decrease signal intensity. To differentiate it between a mass and normal tissue, use reticuloendothelial contrast agent. هنا without reticuloendothelial contrast agent, هنا reticuloendothelial contrast agent called make liver very dark and bright mass. Scintigraphy used to show the well-functioned tissue. Other question. True or false? تفضل دكتور.
بس هذا سؤال، عندنا سؤال هذا؟
ايه دكتور سؤال.
واحد يجاوب من الشباب؟
اي نعم استاذ. Spleen is homogeneously enhanced on early arterial phase. False دكتور. Inhomogeneous.
As we mentioned previously. False. Portal venous system. The blood of GIT and spleen and pancreas all drain to the liver through the portal venous system, which form through the portal vein formed by unit of the splenic vein and superior mesenteric vein behind the neck of the pancreas. Superior mesenteric vein located to the right of the superior mesenteric artery drain the same area that supplied by the superior mesenteric artery have the same branch except on the proximal have right gastroepiploic and inferior pancreaticoduodenal proximally. To the left, jejunal vein and ileal vein. Right, ileocolic vein, right colic and mid-colic vein. Splenic vein. Splenic vein also formed by small venules, exit or run from hilum and unit to the superior behind the neck or the pancreas at level of L1 or 2 lumbar vertebra. This ultrasound show the portal vein confluence, superior mesenteric vein and splenic vein. This is portal vein confluence. CT scan, coronal section, superior mesenteric vein, splenic vein, form portal vein. Inferior mesenteric vein located to the left of the inferior mesenteric artery. This inferior mesenteric vein, inferior mesenteric artery, branch of inferior mesenteric vein, sigmoid branch, superior rectal branch, and left colic, some pancreatic branch. Portal vein formed behind the neck of the pancreas at L1, L2 lumbar vertebra from the unit of the splenic vein and superior mesenteric vein. Then it behind take branch behind the neck of the pancreas with superior pancreaticoduodenal branch, and behind the left first part of the duodenum, left gastric vein and right gastric vein, which also called coronary vein, run free in the lesser omentum and separated by the inferior vena cava from epiploic foramen at this area called portocaval space, which have normal lymph node that enlarge due to any pathological process. At the porta hepatis, the portal vein divided into right portal vein and left portal vein. Right portal vein sometimes receive the cystic vein, and left portal vein receive the umbilical vein and attached to the ligamentum teres and its continuation ligamentum venosum. And this axial CT scan show this aorta, celiac trunk, superior mesenteric artery and hepatic artery. هنا البورتال vein, هنا branch right and left branch of portal vein, right branch of portal vein and left branch of portal vein that unit to the ligamentum teres. هاي portocaval space. Portosystemic anastomosis. Normal portal venous pressure 5 to 10 millimeter mercury. If raised portal venous pressure is due to obstruction in the portal vein or problem in the liver or in hepatic vein, many collateral system pathway appear and communicating. We have 4 collateral systems at the gastroesophageal junction between the esophageal vein and the left gastric vein. Second, at the umbilical between the para-umbilical vein and the vein of the abdominal wall. And at the rectum between the superior rectal vein and inferior rectal vein. At the mesentery between tributaries of the bowel and the retroperitoneum, renal and phrenic vein. According to radiological feature of portal venous system, plain film, the portal vein not seen on the plain X-ray on ultrasound posterior to the hepatic vein and the common bile duct, hepatic artery and common bile duct. The portal vein have echogenic line more than the bile duct branch. On the CT scan, generally posterior to the hepatic artery and common bile duct, separated by inferior vena cava. Okay, separated in porta hepatis from inferior vena cava by epiploic foramen. Gas in the portal vein can be differentiated. Gas in portal vein occur due to ischemic bowel and normally due to insertion of the tube. Can be differentiated from pneumobilia by gastric. Portal vein gas peripheral pattern, but the central gas from the common bile duct is central pattern. MRI, excellent method to provide detailed information about the portal vein and portosystemic collateral. According to portography، البورتوغرافي شنو هو؟ البورتوغرافي هو radiography of portal vein after injection of the contrast material, direct and indirect. Direct portal vein splenoportography, transhepatic, transumbilical. Indirect contrast media inject to celiac and superior mesenteric artery, and the picture take in the venous face. This picture show the arterial portography, inject of contrast material in the portal vein. We show in the axial CT hyperdense parenchyma except the lesion supplied by artery, hepatic artery. Whose time? العفو دكتور، كويز.
يلا اوكي. اسماء خزعل.
نعم أستاذ. أكزيال سيتي أي التيل أفل بالكرياس.
اوكي. دعاء علي.
نعم أستاذ. البي أكسسوري سبلين.
أول شيء صحوله.
سبلينيكولاي.
سبلينيكولاي أو سبلينيويا. زينب خضية. سي.
افتحوا المايكات شباب.
زينب خضير. بهجت.
نعم أستاذ. inferior vena cava.
هاي بيش. أمل داود.
نعم أستاذ. دي سبلينيك فين.
سبلينيك فين.
نعم أستاذ.
مينا.
نعم أستاذ. الإي left adrenal gland.
اكسلنت. عاشتي.
بس العفو دكتور، عندي سؤال على هاي الصورة.
تفضل.
بالنسبة لهذا الأكسسوري سبلين، يعني هذا شلون يعني احنا نحدد إنه هذا أكسسوري سبلين؟ يعني مو إنه تكون ماس عادية، يعني هاي لازم ناخذ بايوبسي أو نسوي له
The same characteristics of the spleen. By ultrasound, by CT, enhanced or non-enhanced، كلها the same. والسايت مالته عادة مثل ما قالت هو يكون بالهايلم. Sometimes يجي adjacent to the inferior port. لا ما يحتاج.
شكرا دكتور.
ممنون.
شكرا جزيلا.